Hello everyone, welcome to Dentistionary. We are back with our CBS lectures. In our last lecture, we have already discussed some basic points regarding the physiological anatomy of heart. And today in this lecture, we will be discussing in detail about the cardiac cycle and electrocardiogram. So let's begin. What is cardiac cycle? It is a sequence of changes in the pressure and flow in the heart chambers and the blood vessels in between the two subsequent cardiac contraction known as the cardiac cycle. Hope you guys remembered what are the heart chambers we read in our last lecture. They are the two atria and two ventricles. That is the right atrium, left atrium, right ventricle, and lastly the left ventricle. Clear? So these are the four chambers of heart in which the flow of blood is continued, and this sequence of changes in its flow is called a cardiac cycle. Clear? Next, what is the normal duration of cardiac cycle? It is approximately 0.8 seconds at the heart rate of 75 beats per minute. It can vary person to person, but the average or the normal heart rate is nearly 75 to 80 beats per minute. Okay? So depending on this point, this time can be varied. What are the stages? The four major stages are the ventricular systole, ventricular diastole, atrial systole, and the atrial diastole. Systole means contraction, diastole means relaxation, right? Coming on to this time gap, we'll be discussing it in details in our next slides. Next, here are the events. So let me discuss it in details. Firstly, we have the atrial systoles. Atrial systole lasts for approximately 0.1 seconds. Here, the both atria contract and force the blood to flow from atria into the ventricles. Let me suggest you one thing. You can visit my previous lecture for more details. Then this lecture will be properly understood by you all. So what I said, in atrial systole, the both atria contracts and force the blood to flow from atria to ventricles, right? Next, what we have? We have the ventricular systole. Here the duration is nearly about 0.3 seconds. This phase has three major stages. They are the isovolumetric ventricular contraction, rapid ejection phase, and slow ejection phase. Let me write it for you all. So what are the three stages? They are the isovolumetric ventricular phase, next we have the rapid ejection phase, and lastly what we have? We have the slow ejection phase, right? Clear? Please note it down. So what is isovolumetric relaxation phase? This lasts for 0.05 seconds. Here the atrial contraction is over and the pressure in both atria and ventricles fall. Please note it down. Here the pressure reduces in both atria and ventricles. The ventricular contraction begins when the cardiac impulse reaches the ventricles. Now, the pressure begins to rise. When it rises more than the atrial pressure, then it causes the closure of AV valves. Correct? When ventricular pressure rises more than the atrial pressure, then it leads to the closure of AV valves. Now hope you remember the first heart sound. Yes, the closure of AV valves led to the first heart sound. Next are the ventricles now closed. These are now the closed chambers and the pressure rises further as myocardium contracts isometrically. Correct? Coming on to our next step, that is the rapid ejection phase. In this phase, when the interventricular pressure exceeds the pressure in aorta, and the pulmonary artery. Then the rapid ejection occurs. The aortic and the pulmonary valves open, and the blood flows from ventricles to aorta and pulmonary artery. Please listen to it carefully. It is one of the most important topic which which maximally asked in your profs as well as in your terminals. Next, what we have the slow ejection phase. What is the time duration? It is approximately 0.15 seconds. Here, the ventricular and arterial pressure starts falling as the blood is flowing away. Correct? I will show you one graph. Please include your graph in your answer. The next step is ventricular diastole. So what we read arterial systole, we read ventricular systole, in which we have the three main phases. They are isovolumetric contraction, rapid ejection, and slow ejection. Next step is the ventricular diastole. It has five major phases. They are mainly the protodiastolic phase, isovolumetric relaxation, rapid filling phase, and slow filling phase. Last what I said, the rapid ejection and slow ejection phase, but in this ventricular diastole, we have the rapid filling phase and slow filling phase. Correct? Next, which lasts for approximately 0.7 seconds. Here the atrial muscles relax and the atrial pressure gradually increases due to continuous venous rhythm. Increases due to what? Due to the continuous venous rhythm. Hope so. Cycle stages are clear to you all. Yes, this is the chart or this is the graph that I was talking about. Please mark it as important and practice it as many times as possible. This is mentioning the heart sound, which is measured by phonocardiogram. It's the ECG that we will discuss it later. Next comes the ventricular volume, ventricular pressure, arterial pressure, and the aortic pressure. Clear? Okay. Moving further is the ECG. What is ECG? ECG stands for electrocardiogram. So electrocardiogram and electrocardiograph are the two major terms you will learn here. The instrument measuring this is known as electrocardiograph. See, I have written. The record of this electric fluctuations during cardiac cycle is called electrocardiogram. Okay. Thus, the ECG recorded at the surface of the body represents the resultant activity in the individual myocardial fiber. So, what is ECG? Let me read this one. Body is a volume conductor, right? That is, the body fluids are good conductor of electricity because it contains certain large quantity of electrolytes. Therefore, now these electric changes occurring in the heart with each heartbeat are conducted all over the body and can be picked up from the body surface. Now, this record of the electric fluctuations is measured during the electric cycle, which is termed as electrocardiogram. Clear? As our body is a volume conductor, that means the body fluid present in our body act as a conductor of electricity. So, the electric changes that occur during each heartbeat is conducted to different parts of the body, and this can be picked up from our body surfaces, right? Now, this electric fluctuations can be measured, and it is termed as electrocardiogram. Hope so this is clear for you. Next are the waves associated with electrocardiogram. I will show you the graph, which will represent the ECG. First wave is the P wave. We have P wave, QRS complex, T wave, and U wave. So what is P wave? It is the first wave of ECG, having duration of 0.1 second. It is directed upward, rounded, or pointed, right? Means if this is your ECG graph, I'm just showing it in graph. So this is pointed upward. What do you mean by rounded? It will be like this. Clear? or maybe pointed. So this is the pointed one. This is the rounded one. Clear? It is due to arterial depolarization. Please note it down. It occurs due to arterial depolarization and it represents the spread of impulses from where? From the SA node. What is SA node? It is one of the pacemaker tissues of our heart. It causes spread of impulses from the SA node to arterial muscles. Clear? Its peak represents the invasion of AV node by excitation process. Very important. Clear? Next is the PR segment. Then we have the QRS complex and then Q wave. Lastly, we have the T wave and U wave, right? P wave, QRS complex and T wave. These 3 points should be mentioned compulsorily in your answer when you write something about ECG. Other segments can be ignored, but try to mention those 3 major points. Clear? This is the T wave that I am talking about. We'll provide you the PDF of these slides. So please note it down such points, okay? Such important points, please note it down in your note copy. Yes, this is the graph that I was talking about. It is the P wave. See, it can be round or it can be pointed like this. Next is the QRS complex. Let me change the color. Yes, so this is the QRS complex and this is the T wave. P wave, QRS complex and T wave. Let me write it down for you. First we have the P wave, then we have the QRS complex, and lastly the T wave, right? Very, very important. Hope so cardiac cycle and ECG is clear to you guys. So that's it for today's lecture. We'll continue CVS with cardiac output and other major topics in our further videos. Keep supporting and keep showing your love towards dentistry. Thank you.